Welcome. I have a patient of mine, Joshua, who came in today. I've been seeing him for a little while, and he has I asked him to come on today because he has just a great story. Struggles like all of us have struggles in our life, and but he's really a really inspirational story of hope and turning his life around. And so I wanted him to tell us his story, and then I'll be stepping in occasionally to ask him questions. So Joshua, welcome to the show.
Thank you. Thank you so much. Yeah, I would say 3 years ago, I was homeless in Huntington Beach, um, Main Beach, and there's a lot of gang activity that people don't know about. And I mean, I've been homeless in San Juan, all over, but Huntington Beach was gnarly. And one thing they did that was really common was meth. The gangs had meth, and they would come bring it around and sell it to us. If I had to defend myself, next thing you know, there's a gang member saying, "Congratulations, good job," and like as if it's a good thing to fight. You know what I mean? Damn, like, these guys are crazy.
Hmm.
And anyways, so that's when my road journey, I should say, like dark journey with meth began. Um, I mean, I had done it at 19, and I had done it on and off in my life, but like I had never really, the stimulants weren't my thing at the time, you know? But like cocaine, meth became an issue right at 26, and because of being homeless. And as being homeless, goes, they do meth to stay alert, awake. And that point, it does more harm than good for me, but I also have ADHD. But with co-occurring bipolar, just doing crystal meth alone, that became, I would get arrested, I'm not like crazy, but, I mean, enough to know that it was the drug, they make a crude version of what is the I guess. I mean, as you know, like, and with using crystallized chemicals that are just out of, bad.
The Dizoxin, because the Dizoxin they use because it's a prescription one,
Yeah.
but it's also methamphetamine.
Yeah, it's pharmaceutical, I guess. I mean, from what I've read about it,
Yeah,
like,
and do they use that, or they chop that up and use that?
oh no, they don't use that at all. No,
Oh,
no, I'm saying they make a crude version. Crystal meth is a crude version of Desoxin,
okay, yeah.
a non-pharmaceutical. Yeah, it's like I mean, it's more potent, it gets you higher, but one hit is equivalent to like 100 milligrams. And they say that you only take 5 milligrams of Desoxin. But I'm really interested in pharmacology, and I actually want to become a pharmacist. I'm a pharmacy technician. It's one of the things I want to do if I end up going to school at Saddleback.
Mhm.
So for me, what progress is is right now, I'm looking to go to school at Saddleback. I am applied at enough places to I'm going to get a call back from somewhere. Um, I do know that my mom was like, "Josh, like at some point, you know, my old doctor always said, meds are an aspect, but for someone like you have to also do the work." You know what I mean? Like, because I tend to just, I grew up kind of spoiled in a nice neighborhood, San Juan, and you know, like my parents are great parents and phenomenal, but I've had, I am used to mom doing things for me, and
Mhm.
um, I think that I take it for granted that I have these great parents, and yeah, I think that that's something that I do, or still do. But what progress really looks like for me is 80 plus days clean from meth since I've started seeing you. It's unbelievable. Not like you like saved my life, like straight up.
That's
But
why I love doing it.
yeah, no, like
Yeah.
you straight up saved my life. And I had a meeting therapeutically because he's not a psychiatrist. He's a pediatrician, MD, and like a, s- there's a different title he has, but he can prescribe psych meds, but also um, do it legally. You know what I mean?
Hmm.
And it's like some sort of different title. Saw him since I was a kid. And I said, so I met with him on a therapeutic level. He said, I want a list of your meds. He said, your meds are not off from what I would have you on. You know, he said, Klonopin was the only thing he believes in the benzo maintenance like routine. But aside, you know, he would have an increase in that. But he said, you know, you've got it going on. You just have to do the hard work that you know need to do, and I've you know as I've been doing. But yeah, no, progress for me was having a place to live, and being sober for it's probably 90 days now.
Mm-hmm. All right.
I don't do AA personally. Uh, it's yeah, so that's kind of like a huge thing for me. I've done like a full turnaround in my behaviors. Like I had, you know, some serious internalized rage that would like like I hated people. It was dark. It was a dark time because I've had rejection from a lot of people. And been to all these rehabs as an addict, you know, and they can give out something like Subutex, which I snorted in the bathroom. I literally snorted Subutex in the bathroom the whole time I was there. You know what I mean? I was an opiate addict in rehab. You know what I mean? So they give out that, but they can't give out something like Vyvanse for my ADHD, which completely solves my cravings. It doesn't make me want to self-medicate with meth. If I take 70 milligrams, I just feel, okay, I'm going to apply for jobs. I'm going to stay sober because it's not really, I don't get cravings like that anymore. That's not even what I think, but that's just kind of what, you know, I do. You know what I mean? I just don't go out and get meth, and it's just how it is. I like AA as a program, but a lot of people have ruined it because it's like, if I'm on this med, then you're not gonna see me as sober. You know what I mean? But it's like I have a dopamine deficiency. It's what ADHD is, but I actually know I can feel it when I don't have my ADHD meds. I don't get out of bed. I do not I don't do anything. I sleep throughout the day. I have chronic fatigue. And I'm a little freaked out because sometimes I start to have involuntary movements that goes away when I take my meds. But without them in rehab, I would have involuntary muscle movements, and was like, is this early Parkinson's? This is not good. Like, I'm hoping that's all it is. But I do have nerve damage, neurological issues. I'm not trying to ramble. I don't know if you have anything to say as well. Okay,
Go
cool.
for it.
You know, I've had some serious adult trauma as well, from sexual to physical. Physical. Fights are fights, but still, when you get jumped, man, but you know, in jail, I've had people try to grab my, you know, genitals, and I, you know, ended up beating the shit out of that guy. And, you know, then the COs were wondering if they would give me more time, but they decided that because of the situation, they had sympathy for me, you know. That was the one time that I ever did more than a night in jail. I had done DUI, possession, but no, it was, possession of Oxycontin, yeah, when I was 18. That was the first time. But for 36 days, I was in jail for resisting arrest and obstruction, felony obstruction, slipping through the handcuffs a ton and trying to, you know, and once again, though, that's crystal meth. You know what I mean? Like, I don't know. Yeah, sorry.
No. Tell me about the opiate addiction. When did that start? And how were you able to beat that?
Kratom. But then Kratom turned into, it started at 18. And it's funny. I feel like he was trying to teach me a lesson. I don't know. It didn't get as bad into, I got sober from opiates right when the fentanyl problem started. So I dodged that bullet. But I was still on Suboxone, though, for long term, and did a number on my teeth, did a number on my, more than meth, I think, because of how it's just how acidic it is.
So you're off Suboxone for a while now, right?
Oh, yeah. Been off Suboxone for a couple months, maybe 3, yeah.
And you didn't have any difficulty getting off of that?
Because of Sublocade, no. no withdrawals. They give you one shot and you get off
Oh,
it.
okay.
I became a Suboxone addict when I told someone I was a Kratom addict, and they gave me Suboxone for Kratom. Suboxone's way stronger than Kratom.
Yeah.
Like, so he would just, his name is Dr. Joe DeSanto. I don't know. He's not a terrible dude, but I don't know, dude.
Mhm.
He totally messed me up with the Subutex, because the
Mhm.
Subutex, it's like taking something that's slightly stronger than heroin
Mhm.
for a Kratom problem. I don't know.
Tell the audience too about Kratom, what that is, and where you got it, where you get it. I think it's available at smoke shops,
Yeah.
isn't it?
So kratom is available at smoke shops. It is a leaf, just like the fake plant right behind us.
Mhm.
Like it is. Oh, I didn't mean it like that. I just was no, I just was calling it like, yeah. I didn't mean it like that. Anyways, it's a leaf that they crush up into powder and put into capsules,
Mhm.
and you just take a bunch of the capsules, and it takes about 5 for you to feel something. So you have to take 5. So you end up taking, you have a 30 gram
Mhm.
um, uh, a kratom problem a day, 30 grams a day. Your liver is overworking itself with
Mhm.
all of the leaves.
Right.
It's constant plant matter just
Right.
going in it, so it's overworking, and it's a problem because it is, so maybe Suboxone wasn't the worst choice, just that my teeth, and I'd say my testosterone, I don't know what it is, but it can't be high because, I don't know. Anyways,
Mhm.
yeah.
Tell me about your when you were first diagnosed with ADHD. How old were
Um,
you?
I was in 5th grade
Mhm.
and then constantly re-diagnosed. I had neurological brain testing with wires on my skull. All of that, and did a brain scan. They said, yes, he definitely has ADHD.
Mhm.
Autism, they thought maybe, they were like, maybe he has some sort of, no, failed the test for autism.
Mhm.
But it is without a doubt I have ADHD. That's the only thing that the doctor ever diagnosed me with. He doesn't
Mhm.
like to diagnose. He said I have bipolar tendencies, but at this point he thinks I'm bipolar too. But yeah, anyways.
When did you first get the bipolar diagnosis?
19.
19 years old. Yeah.
And that was when my life went down the crapper. Like it like just became so okay. I'm not sure
Because that's when
exactly.
you were doing meth already at that point, and when you were 19. Yeah.
Yeah, but no,
Yeah.
but it went down the crapper before.
Tell us about that.
Yeah. So sure thing. Okay. um, it was it was weird. I started personally developing issues, um, like ED. I don't know where it came from. I think pornography played a part,
Mhm.
possibly. I don't know.
Mhm.
Um, but there was that, and that's gone away actually, which is kind of interesting. But it was a thing when I was 19 to like 22. So there was that, and um, another thing was that I got jumped. So it's really called complex trauma by a former therapist, Angelina Grip, who's an amazing therapist. She understood me. My parents didn't agree, with certain things, but that's my parents.
Mhm.
Sorry. What was the question you were asked?
About the bipolar diagnosis and how did that present? Were you having like
Yes,
manic
yes,
episodes
that's
or?
right. So, um, I was suicidal. Um, I wanted to die, and just life. I wasn't happy with life how it was in general. Um, and this is before meth. I was doing cocaine.
Mhm.
Was doing other drugs like cocaine. And alcohol. So that doesn't help. It's a depressant, and got locked up in the psych ward. Because my grandma, I don't know, she called the cops on me because I had a knife in my wrist in the bathroom. She was knocking on the door. Josh, what's going on? I opened the door.
Mm.
She's like, why do you have a knife? And I was like, I was honestly gonna slit my wrist. And she just called the cops,
Mm.
and or the paramedics or whoever you called for. It was some sort of mental health task force that talked to me, and they thought that I should be in the psych ward.
Mhm.
And they were right. And sure enough, I told them, I said, look, I see a psychiatrist. He gives me 3 milligrams of Klonopin a day. They put me back on the Klonopin, and
Hmm.
I could go places. The reason why I was suicidal is because of my social anxiety.
Hmm.
I have debilitating, crippling social anxiety. My mom, a McDonald's girl said, "You have a nice car. I like it." I started getting severe anxiety. Like this is prior to Klonopin.
Hmm.
That like I'll be like sitting there anxious because someone told my mom she has a nice car.
Hmm.
I don't know why that gives me anxiety, but it does. It's like if someone says I lost my backpack, I will act guilty as if I stole the backpack.
Hmm.
Like it's levels, and I don't know if that's bipolar maybe too, but it's levels to the anxiety that I have, and I would say my anxiety is almost just as bad as the ADHD, just because
Hmm.
of how um, I don't know how crippling it is. It's just being unable to be around a group of people. You know what I mean?
Hmm.
So I mean, it was helpful. I know you didn't like prescribing benzos, but it was helpful that you understood
Hmm.
that I told you my prior doctors, so you understood that, I'll go to 2 milligrams, but because it really helps. Because without it, I wouldn't be able to go to church. Well, I would be able to go to church because the Vyvanse helps with some of the symptoms, but still,
Well,
um,
with benzos, when I give other medications and we get you a lot better, like where you are now. But when you still have residual anxiety, that's where the benzos are appropriate. We
yeah,
try to minimize them and just use them as needed, not to overdo on them.
I know,
But I think, like I said, you can't. You're mentioning anxiety. Social anxiety is common. You can't always explain like why you're anxious. People try to
sure,
figure out
that's a good point.
like everything's fine. It was a compliment. It was, why would that cause it?
That's a good
When
point.
you try to like understand anxiety, you can't, and that's frustrating because you think, well, there's nothing here that should be causing me anxiety, and why would
Exactly.
it?
Yeah, yeah, yeah,
And
yeah.
I feel weak because I feel it's just and all these things go together: the anxiety
The
disorder, the
weakness part, yeah,
bipolar, the ADD. All of it kind of in your case, all kind of converges.
exactly.
Something that I talked to Josh about is here's a controversial topic. In my view, it really shouldn't be, but it is. So in his case, giving him an ADD medication, some doctors might think, oh, we can't do that. He has a methamphetamine or in crystal meth history or cocaine or whatever. We can't give him a stimulant because it's just feeding into his addiction. I disagree with that. Okay. Now there are certain people, certain addicts that can't do it. In other words, if I give them a Vyvanse, they'll take 3 of them.
Mm,
So there are some people that they can't do it. They can't do it. They can't keep it controlled. In Josh's case, it's different because he's
definitely.
actually able to, he's on a good dose of Vyvanse, and he needs a higher dose. That's just the reality. And I
Yeah,
always have him on afternoon Dexedrine, but in his case, and he already said it. Taking that and actually treating his ADD is going to keep him from going getting meth on the street. So, when people, and with what I do, it's really with my experience, I can tell like who if someone is if it's appropriate. And he had this ADD diagnosis since fifth grade, but it actually really starts earlier than that. It was just caught at fifth grade.
it's true.
And so that's why treating his ADD, if we didn't do that, he wouldn't be 3 months sober right now. It just wouldn't be happening.
No, we're not
His
there.
body would drive him to treat the ADD so much that he would not be able to stay sober. So basically, so I disagree. Now, again, and when you go to rehab facilities, they are very one track minded. They feel like no controlled substances while you're here at all. Maybe we'll give you some Klonopin, but not because they're going to think that stimulants are going to actually increase your anxiety when they actually don't. Stimulants, like in his case, and in people with ADD,
They lower it.
they calm the brain. They actually lower anxiety. But again, I think when you're inpatient and in a facility, it's very simplistic minded. It's like we just don't do this here. We don't do that here. But the problem is when you're in a facility and you don't treat the ADD, other things get worse too. Um, Now the bipolar diagnosis with him, we have things really pretty very well controlled. He's on a combination of Abilify, Seroquel, gabapentin, and Topamax, right? I think that's the
Yeah,
four.
the Seroquel just got switched to the trazodone.
Oh, trazodone, that's right. Too
Just
sedating.
yeah, it was too sedating, and also I need to lose weight
Oh,
because
right, that's right.
yeah,
And then the
but
Abilify, we're moving the dose of that up.
yeah, to 15.
You're at 15
I
now.
have 15 now,
How's
and
that?
honestly, I love it. Like,
Good.
yeah,
Yeah,
I
he was at 5 milligram. I had him go to 10 and then 15,
yeah,
and that's going to help lower the anxiety. It's going to help him. So I
it
have,
does definitely do that, and
yeah,
it really, really like I heard it's a dopamine regulator.
yeah,
Yeah, it really does. Is it like completely like I don't know? It balances out the Dexedrine
right,
because you're right about short acting meds with me, they hit harder and last shorter. So yeah, it's I was like, dude, I guess I'm talking like crazy. I don't even know it. Like, am I? And my mom was so annoyed. But ever since the Abilify, like
yeah.
it's been yeah.
See, you mentioned your dopamine. You're right. Dopamine's a major issue with you. So with people with ADD and often with people with depression, they have a low. Basically, it's not the dopamine level is low in the body. It's just not moving very well. It's not traveling well. So the Vyvanse and Dextrin, in his case, boost the dopamine and get that moving and get the focus and concentration. Abilify
That's how it
basically
works.
calms dopamine down, and we call it dopamine antagonist. So it actually helps to regulate. And that lowers the anxiety.
Oh,
And then the gabapentin and Topamax boost GABA. Now, what else helps with GABA is Klonopin.
oh,
So with gabapentin and Topamax, it has a role also with anxiety reduction
oh,
and also stabilizing your mood. So basically, the two major chemicals with you and with many patients like yourself are dopamine and GABA.
yeah.
Dopamine number one, GABA number
Yeah,
two.
number two. Yeah.
Yeah, and that's with the combination you're on is just focusing on those two chemicals.
Mm,
If we give you something like an SSRI or an antidepressant,
it's not gonna work.
it'll make you worse.
Yeah.
It won't work, and
Whoa.
it'll make everything worse. Exactly.
Right. Yeah. Because the doxepin, um, like I think it was before you knew I was bipolar as well.
Hmm.
I think the Dexedrine is what eluded that you gave me the official diagnosis.
Yeah.
But what was it called? The doxepin. Dude, yeah, it made
Hmm.
me the next
Yeah.
day. The next day, I was like, I can't look anyone in the eyes. Like, it just yeah, it was weird.
Yeah.
Like, and
And
that's
then
another reason why Klonopin's important because it's part of it, social anxiety for me is poor eye contact, all that. You know what I mean?
mhm.
So sorry.
Yeah. And yeah, the one ADD medication I don't prescribe is Digoxin. It's too similar to methamphetamine, so I don't prescribe that one. But I treat a lot of ADD. And like I said, in Josh's case, his meds are at just the perfect, like we call the Corona cocktail. Uh, he's on a really good mix of things that really are kind of balancing you out, and now it really empowers you to be able to live a normal life now, get a job,
Yeah, dude.
maybe at some point getting in a good healthy relationship. And I encourage you to go to school for sure. I mean, get a job, but I say
That's what I'm.
go to Saddleback College.
Yeah.
Great college, by the way. It's a great junior college locally. My son went there for a few years before he went to 4-year. Great place, and then they have a lot of different learning job skills.
Cool.
So becoming a pharmacy tech, if you're interested in that, that's definitely something you should pursue.
Yeah.
For sure.
Yeah. Or a mental health worker.
Yeah, or
And
mental health workers. Some people.
yeah.
A lot of people with their jobs, a lot of people with addiction histories work in the field. They
Mm.
work with sober living places, they work with inpatient facilities, they work in detoxes.
Yeah. That's true.
And because of the experience you have, your opinion, you can help people who are struggling
That's true.
because you can
Yeah.
say, look, I've been where you are, I know where you're at, I know where the struggle is, but the good thing is, look at what happened with me. Look what I'm doing now. Look how far I've come. That you have hope.
Literally.
You have hope. So even when things were
Yeah.
dark, like they were
Sure.
with you in the past, you didn't give up hope.
Mhm.
And I see that all the time with patients that they, you would think that they would think I'm never things will never work out for me, and they're wrong.
Mm.
So
Mm. Thank you so much for saying that.
yeah.
Yeah, like that's my goal, and my goal is not to, make the recovery people mad ever, but like
Hmm.
I just wish that they would have worked with me. I was like,
Yeah.
you can't at least give me like Concerta. Like he was like, nope, nope, nope. Like, well, you're not going to get the Josh that you want. Then you're complaining that I'm not attentive. You're complaining that I'm
Hmm.
too anxious to be around you. I'm complaining this, and this basically, and like you're not going to get the Josh that's truly Josh. Who's balanced.
Yeah, I mean the treatment in inpatient facilities is not always the best. It's just not.
Mm.
And so I mean I think that there's obviously good things with when you go into detox and rehab facilities. There's good things. There's groups there. You learn a lot. But some of the times when it comes to the medications, they're not always the greatest when it comes to what they give you medication
Yeah,
wise.
no, no,
You
they gave
know,
me Seroquel for sleep only. Like yeah, no, I mean, they're just the meds are just off.
yeah,
They use clonidine for anxiety. I'm like, dude, that gives rebound blood pressure.
yeah.
Like where you get, then my blood pressure was in the 130s the next day after taking clonidine.
Hmm.
I was like, dude, you're gonna give that to me for anxiety?
Hmm.
Like Ativan, I wouldn't even feel 1 milligram of Ativan, but you could at least do that.
Hmm. Hmm.
Like. But
Yeah,
I don't hate on them because honestly, I
yeah.
don't. I really don't. But
Well, no, nobody's perfect, and I mean,
yeah, true that.
I make errors with the thing is in this field of medicine, you almost have to be wrong to be right sometimes because it's all a lot of trial and error, a lot of testing things out. Like I said,
Yeah,
even with you
right.
with your AD medication, it took a little bit while to get to the Vyvanse dextrin mix
Yeah,
because
true.
you tried different things, they didn't work.
The
Concerta didn't
Wellbutrin didn't.
work,
Yeah, yeah,
Wellbutrin didn't work.
yeah.
So it takes a lot of that to figure out,
It's
a
true.
lot of trial and error. But I call it rational trial and error because there is a rational basis to what I do. It's just you got to figure it out. In other words, Seroquel not being for you, trazodone better, upping the ability. It takes a lot of this like trying things out, testing the waters.
True.
So, but
And one
yeah.
thing that and why it makes it kind of hard just to go to meetings sometimes is because like one guy told me, and I shouldn't let one person ruin a whole program. So like
Hmm.
that's kind of where I think I'm wrong. I'm wrong. But one person said, you will never just take 70 milligrams. You'll always take extra. I'm like, dude, like since I've been on the Vyvanse, I've just taken 70. I've never taken more than 70 at once. So
Hmm.
you can't tell me that because and believe me, I've heard people online say I'm on 120 milligrams in Australia. I guess I
Hmm.
don't know if that's the max dose, but this is on Reddit. But
Hmm.
I was like, dang, I could probably, like you said, I do need. It would be nice to have a higher dose, just because of the fact that sometimes 70 doesn't last long enough. And I do think that I have a tolerance, but it is what it is.
But when it wears off in the afternoon, when you put the dextrin in, does that help
Oh,
get?
it totally helps.
Yeah.
It's
Okay.
yeah,
Yeah, so that's what we do. Usually increasing the dose of the Vyvanse doesn't make it really last longer. It still lasts the same amount of time,
mm,
but a lot of times it doesn't last the whole 10 to 12 hours like it's supposed to. It'll last maybe six, say maybe 8 hours,
8 for me. Yeah,
and then what we do is put a short acting in the afternoon with a dextrin. And a dextrin, if a 10 isn't enough, we could try to go to 20. But
would be nice.
yeah,
Be honest.
we could talk about
If we,
that,
yeah,
but yeah, we don't want to do too much, but we have to do the right amount for you,
for sure.
and you're an individual, and you have individual needs, but the progress you're making, I'm really really proud of you. I'm really
Thank
proud of
you.
the progress you've made, and
Appreciate you.
you've really hung in there, and
It's been
kept
a
in
journey.
communication with me, but yeah, I think that you're on the right track. There's sometimes bumps in the road, but just try to maintain. And when you get to that place of you're thinking about your things are slipping, you're thinking, I think I might use, call me,
I will for sure.
call someone you trust and say,
I will.
what, I'm thinking about using right now. I know this is terrible. I don't want, I've been there 90, 120, 2 years. whatever it is. There's going to still sometimes be with those times of temptation,
Sure.
and those are sometimes the tough times,
It's
where
true.
you really want to, or you think addicts kind of think, oh, if I just do it one time, it's kind of like a cigarette smoker who thinks they've given up cigarettes, which is very difficult to do,
Mm,
and then they say, oh, I'm just going to have one cigarette just for old time's sake.
mm,
It never stays at one cigarette.
it's true. Never.
One leads to two,
Never.
leads to a pack, leads to a carton. It's very difficult to control nicotine once you've stopped. And the
Mm.
same thing with methamphetamines, with opiates,
Anything
know,
addictive.
anything addictive, it has that
It's not.
addictive draw,
Yeah.
you know.
I don't know. For me, I actually, for me, it's not anything addictive because I don't know the Klonopin and Vyvanse and Dexedrine. I don't. Yeah, I don't take
Yeah.
them. I don't take them at doses like any more than
Right.
Yeah.
Yeah. And we'll
But
talk. I mean, like I said, if we tweak things or whatever, then we'll talk about, if we're gonna do something like that.
for
So
sure, it's been a huge part of my life,
yeah.
and for a long time, since before I saw you as a doctor, and I like that my slash therapist or what he came over and when he was looking at it, he was like, this is like what I'd have you on. So,
Yeah.
Yeah.
Well, I'm so proud of you. Like I said, that's
Yeah.
thank you so much for coming in and sharing your story
Absolutely.
with us.
Yeah. No, I'm happy
Gosh,
to.
we're very
Yeah.
happy to have you come in, and
Thank
I
you.
think, like I said, I think the audience is gonna realize that no matter how dark things are, just never give up hope. Okay, if anyone can have a look at this, just hope. Hope is always alive, and so I hope you enjoyed this episode.